Good morning, everybody. Good afternoon. Welcome to the second webinar in our series on climate and health integration. Today, we'll be talking about integrating health into national determined contributions and the third round of doing this. Following some welcome and introductions, we will hear some of the global guidance and a regional perspective, and then we'll move into hearing from some of our countries and how and what they have been doing, followed by some time for questions and answers. So without further ado, let me move to Dr. Sandra DeMeo, who's the Director and Head of Office of the Asia Pacific Center for Environment and Health. Sandra, over to you.
Thanks very much, Sally, and good morning, colleagues and friends from across the region. It's a real pleasure to be able to join us this morning for this, our second in our regional webinar series, convened by the WHO Asia Pacific Center for Environment and Health, created in direct response to country needs to strengthen the integration of health into climate policy across the region and around the world. At WHO ACE, we're working to support member states to bring health to the centre of climate action through national policy, practical tools, and regional knowledge exchange. Nationally determined contributions, or NDCs, are not just climate plans. They're instruments for investment, priority setting, and resilience building. And when health is integrated effectively, they become powerful levers for protecting people and communities. Yet, many countries still lack the technical support and guidance to include health in an operational and impactful way. And that's where WHO, and in particular WHO ACE, in the regional office comes in. We're supporting countries in collaboration with our country offices, our sub-regional office in Suva, and of course our headquarters colleagues to understand where and how health fits into NDCs, to leverage the co-benefits across adaptation and mitigation, and to identify entry points for action, including around air quality, extreme heat, and climate resilient and sustainable health systems. We're also helping countries to align NDCs with other national strategies, including National Adaptation Plans, health and climate roadmaps, and of course, their overarching SDG commitments. With COP30 just around the corner and COP31 very likely to be in the region in 2026, this really is a critical window of time. The decisions we support now can shape national policies, global ambition, and real-world impact that benefits health for our communities, the countries, families, and of course, individuals across the Western Pacific. Thank you again for your engagement. Thank you to all of our colleagues and experts for joining. Thank you to the leadership from my team, but most importantly, the leadership from our member states and our country offices on the front line of climate action. And I look forward to today's dialogue and to working with all of you to make health central to climate ambitions. Back to you, Sally.
Thank you, Sandra. And I'd now like to pass on to Dr. Susie Mercado, who's the Director for the Division of Program Management in Wipro, for some welcome and opening remarks. Dr. Susie, over to you.
Thank you so much, Sally. Good morning, everyone. Good morning, Sandra and the team at ACE, and to all of you who are participating in the webinar. It's flooded here in Manila, so we're all working from home, and connectivity has been a bit of an issue. But anyway, I'm very happy to be here and very happy to see how ACE continues to keep an open space for dialogue on various topics, such as the nationally determined contributions. Now, in the Western Pacific region, we are seriously feeling the impacts of climate and health, but I guess it's all over the world, right? There are heat waves, floods, and all of that. And I think it's very important that we begin to include health in the calculation of the nationally determined contributions. 8 out of the 10 countries of the most vulnerable to sea level rise are in our region, and this is based on WHO's assessment of vulnerability in 2023. More than 1.2 million premature deaths in the Western Pacific are also due to environmental risks and extreme climate conditions. And countries across our region, including here in the Republic of Korea, are showing strong leadership on climate and health with bold and people-centered policies. Now, the nationally determined contributions are the backbone of global climate action under the Paris Agreement. And admittedly, this has not been an easy topic for countries to take up. But I think our understanding of what it means in relation to co-benefits, what it means in relation to advocating for more action on climate is very, very important for the health sector. And so I very much welcome the work of ACE in this space. About half of our countries include health in their NDCs, and this needs to be better. So I think this is a call to action. A congratulations now to ACE for this series of webinars that heighten the understanding and what should I say, clarify the role of the health sector in the work on climate. Because I think, as I said, right, the NDCs, that's not a new idea, it's not a new concept, but I don't think in the health sector we have discussed it enough and that we have understood how important and how powerful it is for advocating for policies and action. Thank you very much and all the best. I look forward to listening to the rest of the webinar. Thank you.
Thank you very much, Susie. I would now like to hand over to my colleague, Enki, who will lead us through the global and regional perspectives. Enki, over to you.
Thank you, Sally. Good day, good afternoon, everybody. So now we are opening this presentation session. The core of the Paris Agreement is to emphasize the specific targets and actions to limit global warming to 1.5 to 2 degrees above pre-industrial level through the NDCs. Just now, Dr. Sandra and Dr. Susie Mercado mentioned that we need to increase health sector leadership and actions in this regard. So the presentation, this session aims to highlight the leadership role of health sector in implementing NDCs under the UNFCCC process. And also this webinar is very timely because it's happening in time of NDC 3 update submission by member states under the UNFCCC process. So we have two presenters, Ms. Amy Savage, technical officer from Climate Change and Health Unit of WHO headquarters. Due to big time difference, she was not able to join in person, but she kindly contributed to this webinar by video recording. And we have another presentation, practical presentation from Arthur Wins, our consultant at ACE, more highlighting on practical aspects of integrating health in NDCs. So I would like to ask Sora, please put the recording of Ms. Amy.
Good morning, everyone. My name is Amy Savage, and I'm a technical officer in the Climate Change and Health Unit at WHO headquarters. And this morning, I'll provide a brief overview on WHO's quality criteria for integrating health in nationally determined contributions, or NDCs. This document was launched last year at COP29 and really aims to provide practical guidance describing the opportunities to incorporate and promote health in the NDC documents and the NDC process in the long term. As a brief little bit of context, you're probably already aware that the parties of the Paris Agreement are requested to develop and submit NDCs. These are national plans that outline a country's commitments to reduce greenhouse gas emissions and build climate resilience to contribute to achieving the long-term goal of the Paris Agreement, which is, of course, limiting global warming to 1.5 to 2 degrees Celsius above pre-industrial levels. And these plans are based on national circumstances, capabilities, and priorities. health has a role in UNFCCC processes generally, and there is significant opportunity for synergy among these various processes. So while the NDC process and other UNFCCC processes like the NAP, the long-term LEDs, are generally led by the Ministry of Environment or Climate Change, ideally the health components of these processes are led by Ministry of Health. So the Ministry of Health should be the one setting the health sector mitigation and adaptation targets and priorities, and along with the health community, contribute to the development process of the NDC and work with other sectors to ensure that health is considered across the NDC and that health gains are maximized. This figure outlines the NDC ambition cycle, which is the effort to strengthen national climate efforts over time. The NDCs are submitted every 5 years to the UNFCCC Secretariat. And of course, the next round is happening now, it's this year. And it is expected that each subsequent NDC that's submitted shows an increase in ambition. So parties can modify their existing NDCs at any time if they're enhancing the ambition. You can also see here that the global stocktake occurs every 5 years, and that assesses the collective progress globally towards achieving the long-term goals of the Paris Agreement. And then that information is used to modify and enhance NDCs and increase ambition. And of course, the assessment that was under stocktake undertaken in 2023, the results of that are being used to inform and enhance the NDCs being submitted this year. Now, you may already be familiar with this diagram showing 3 overarching focus areas for building climate resilient and low carbon sustainable health. And this is just to indicate the NDC process also provides opportunities to strengthen work in all of these areas. So the NDC process can contribute to addressing the wide range of health impacts of climate change, to strengthening the climate resilience and reducing the greenhouse gas emissions of health systems and facilities, and to promote the health co-benefits of climate change mitigation action in other sectors. For the rest of the presentation, I'll focus on the guidance itself. And the structure of this guidance is around the general structure of NDC documents, and it highlights opportunities for health in each of these sections or components. And the first quality criteria area, this number 1, leadership and enabling environment, is cross-cutting and relates to the process and all areas of developing the document. So starting with this first cross-cutting area of quality criteria, we do understand that the NDC process will differ depending on the country context and the institutional arrangements, but a strong health leadership and supporting environment is critical to meaningful integration of health in the NDCs. So the health contribution ideally is led by the Ministry of Health or the equivalent agency. And of course, the NDC process is an ongoing process. It doesn't end with the submission of the document. And it is crucial that Ministry of Health is actively engaged in the process on an ongoing basis. This is important both for health integration, but also for commitment to implementation. So the active role of the Ministry of Health will support also integration of climate change considerations in national health planning and programming. And again, this will enhance or is likely to enhance implementation of the actions and ensuring that they're sustainable. The NDC process can also be a critical opportunity to emphasize that other sectors also have a responsibility to address the health risks of climate change. And the NDC process can be used to support increased cross-sectoral coordination and policy coherence, and ensuring that other sectors consider health in their climate change policies to promote health and avoid any unintended negative impacts. This is the first set of quality criteria that's based on the usual structure of the NDC documents. So the NDC documents often begin with a section that introduces the country's circumstances. And it's important to include health in this introduction section to stress that the ultimate goal of successful adaptation and mitigation is our health and well-being. And this should be the guiding principle of the NDC. We can also describe the health context within the national context sections, and that includes health policy priorities, relevant legislation and regulations, so that we can elevate the health priorities and support health integration across the NDC components. We also want to ensure that the health risks of climate change inform the targets and actions of the NDC and not just in the health sector. And if possible, we want to quantify current and future health risks and use this to inform the targets and actions. A brief example from the Western Pacific region is the NDC of Indonesia, which points to the constitution and prioritizes climate actions that will improve the quality of life of its citizens. The next section of quality criteria relates to the mitigation section or component of the NDCs. And we have 4 quality criteria related to co-benefits, air pollution targets, and mitigation actions in the health sector. And we'll look at each of those in a little more detail. So first, we'll look at the health co-benefits quality criteria. And here we recommend both identification and, where possible, quantification of the health co-benefits of mitigation actions in other health determining sectors. NDCs are mandated to report on co-benefits likely to result from mitigation actions across sectors, and health co-benefits of mitigation are recognized across various sectors, including food, agriculture and land use, transport, household energy. We have very good evidence for these co-benefits, and they offer a strong argument for more ambitious climate action. Evidence shows, for example, that the public health gains from mitigation actions in other sectors far outweigh the costs of these actions. And identification and quantification of health co-benefits can improve decision-making on investments for climate action across sectors. It really supports investment in those actions where the greatest co-benefits can be achieved. And as I mentioned, this provides very strong arguments for transformative change and increased ambition. We have a range of available tools to assess, quantify, and monitor co-benefits. I won't go through each of them, but you can find them in the guidance. So, as a good example, to improve its existing NDC, the government of Colombia, with WHO and PAHO, carried out an analysis to quantify the health and economic co-benefits from implementation of its NDC. They used 3 tools to estimate these health co-benefits related to reduced air pollution. The study showed that an increased mitigation pathway could prevent more than 3,800 premature deaths annually by 2030 due to the simultaneous reduction in air pollutants. It was found that in economic terms, the health gains from the highest mitigation pathway would save approximately $1.9 billion annually. And it was estimated that this highest mitigation scenario would provide 20% greater economic and health benefits than the lower ambition mitigation scenario. It's also recommended that the Ministry of Health works with other sectors to identify and commit to health-based sectoral targets and interventions that have a large potential to reduce air pollution and short-lived climate pollutants, and that are in line with the WHO air quality guidelines. So meeting WHO air quality guideline levels globally can prevent around 80% of premature deaths related to PM 2.5 exposure, and of course reduce greenhouse gas emissions at the same time. Many air pollutants contribute to both global warming and negative health outcomes. So integrating standalone reduction targets for air pollution and short-lived climate pollutants like methane, hydrofluorocarbons, and black carbon, integrating these air pollution reduction targets into NDCs can really result in substantial climate and health benefits. In Chile's NDC, they included air quality regulations for public and private transport systems, household energy, and the industry sector. They aim to reduce total black carbon emissions by at least 25% by 2030 compared to their 2016 levels. And the NDC takes a holistic approach to mitigation, including the health sector. The last quality criteria for the mitigation section of the NDC relates to setting targets for greenhouse gas emissions reductions within the health sector itself. This primarily applies to countries with high health system emissions who should set specific standalone emission reduction targets. Overall, the common but differentiated responsibilities and respective capacities principle should be considered when looking at this criteria. Those countries with limited emissions are recommended to focus on building climate resilience and improving health systems performance, while at the same time considering a low carbon pathway for health systems where this is feasible and of course does not compromise quality of care. And we do recognize that in some cases, this means that national health systems will need to increase their emissions to reach optimal performance and overall climate resilience. But we can see that there are some synergies with resilience and mitigation actions, such as reducing healthcare costs through reduced energy use and optimization of resources, and contributing to health co-benefits. Countries with high-performing health systems with high climate resilient capacity should be aiming to reach net zero emissions as soon as possible and ideally no later than 2050. And WHO has published a document target setting for low carbon sustainable health systems that also has further guidance on setting emissions reduction targets for health systems. Sudan's NDC, for example, commits to providing solar energy to health centers, and Vietnam's NDC commits to energy saving and energy efficiency measures in hospitals. And these actions aim to reduce health sector emissions while increasing access to energy and thus increasing climate resilience. The next area of quality criteria and section that is usually seen in the NDCs is adaptation. Ensuring that health systems and facilities can manage the health risks of climate change and continue delivering care is essential for reducing the health impacts. Many countries include an adaptation component in their NDC, and for some countries, particularly those with minimal emissions, this is a critical component of the NDC. The UNFCCC, in their 2023 NDC synthesis report, found that 81% of NDCs include an adaptation component, and the 2023 WHO assessment of health and NDCs found that around 63% of the documents include health adaptation priorities. So the quality criteria for the adaptation component, firstly, it's recommended that health is identified and integrated as a priority sector in the NDC adaptation component. This is both to integrate and elevate national health adaptation priorities. It's also recommended that the development of the adaptation section of the NDC is fully aligned with and continues to support existing national adaptation planning processes and mechanisms, including those for health. So this process of alignment will differ according to country context, but will often include aligning the NAP and HNAP processes and priorities and the actions and targets described in those documents. Ministries of health and other health stakeholders should work with other sectors to ensure that the health implications, both benefits and potential harms, are considered in the relevant sectoral adaptation targets and measures and components of the NDC across the NDC. And as mentioned previously, there are synergies between adaptation and mitigation, and these can be highlighted in the adaptation component. So a really good example is Lao PDR's NDC. They have included a results-oriented health adaptation framework. It has comprehensive health adaptation targets for all the 10 components of the WHO operational framework for building climate resilient health systems. And they have adaptation actions in health determining sectors as well. So the next area of quality criteria covers loss and damage, which refers to the destructive impacts of climate change that cannot be or have not been avoided by mitigation or adaptation. It's divided into two broad categories shown here: economic losses and non-economic losses. It's recommended that the climate sensitive health risks and outcomes, including in health systems and facilities, are quantified, and that the financial implications of health related loss and damage are also quantified. It's also suggested to include priority interventions to avert, minimize, and address loss and damage to health and health systems and facilities. The NDC of St. Kitts and Nevis, for example, provides an overview of the economic and non-economic loss and damage that's already occurring in their country, particularly due to extreme weather events. So, for example, damage to health infrastructure, rise of vector-borne and waterborne diseases, loss of culture, lifestyle, traditions, and heritage, and negative impacts on physical health, mental, and emotional well-being. And then we come to the all-important area of quality criteria of finance. We know that there is a significant health sector climate finance gap, and that lack of climate finance for health is consistently cited as a barrier to implementation and exacerbates inequalities. But to understand financing needs and to adequately allocate resources, it's necessary to estimate the cost of the health-related actions that's included in the NDCs. These estimates should also include other needs for implementation, including human resources, capacity building, and technology transfer and development. It's also recommended that the NDCs specify the conditionality of climate finance for health actions and plans, meaning that these actions will only be implemented if international resources are provided or some other conditions are met. These conditional actions and funding gaps can inform the foundation of climate change and health funding proposals. And given that the health and well-being of populations, communities, and individuals is the ultimate goal and guiding principle of NDCs, health impacts and indicators should be used as the foundation for prioritizing investments across the NDCs, across sectors. So the results of assessments of climate sensitive health risks, health co-benefits, health loss and damage, these can be used in prioritization exercises to ensure that the investment that countries are making prioritize actions that have clear climate change mitigation or adaptation impact, and also result in the greatest health benefits or health gain. Sierra Leone's NDC, for example, includes an action plan with indicative costs for all activities, highlights the need for international financing and domestic budget allocation, and specifies the conditionality of each strategy in the action plan. And finally, once a comprehensive and ambitious NDC document has been developed and all the targets have been set, we do need to implement those actions. So to achieve the health targets in the NDCs, we need a health sector implementation plan. How will the targets be achieved? And breaking down those targets into implementable actions. So detailing the actions to be implemented by the health sector, both to contribute to the specific health targets, but also to translate national targets into health sector targets, indicators, and benchmarks. Also to detail actions to be implemented by other sectors to help achieve the health target. And finally, monitoring of progress on climate change and health across all relevant sectors, and making sure that health indicators are included in the overall NDC monitoring and evaluation framework. Following its submission of Ecuador's NDC, they developed an NDC implementation plan that had 11 sectoral plans, including health. The health sector plan was led by the Ministry of Health, and it included milestones, outputs, domestic funding, and international support that was required for implementation of the plan. And finally, the guidance also includes a checklist covering all the components that we have discussed today. It's designed to offer a series of guiding questions. So it's not, it's intended as a reference and guidance, not as being rigid or an exhaustive framework, but there to help guide on all the sections that we have covered so far. And finally, for further resources, there's the initiatives such as the Alliance for Transformative Action on Climate and Health that has a community of practice website with case studies, a resource repository, country documents, so you can see how other countries are approaching climate change and health work. And thank you very much for your attention. If you have any questions, do feel free to email us, and I hope you enjoy the rest of your webinar. Thank you.
So big thanks to Amy for comprehensive presentation outlining the role of health sector in achieving the Paris Agreement. We hope that this presentation improved or refreshed your knowledge and understanding of how to embed health in NDCs and main health entry points to NDCs. So the key points of the WHO guidance document, quality criteria for integrating health into NDCs, Amy highlight very comprehensively. So all the components, for example, leadership and governance, health co-benefits of climate change mitigation, air quality targets, health sector emission targets are highly relevant for the context of Western Pacific region. So we
Enki, you are muted.
Oh, sorry. So big thanks to Amy for comprehensive presentation outlining the role of health sector in achieving the Paris Agreement. She comprehensively outlined all the key components of WHO guidance document on quality criteria for integrating health in NDCs. Leadership and governance, health co-benefits of climate mitigation action, air quality targets, health system emission reduction. These are all highly relevant in the context of Western Pacific region. And we hope that this presentation improved or refreshes your knowledge and understanding how to embed health into NDC process. So with this, I would like to invite Arthur Wiens, WHO's consultant, who will inform us our ongoing work on around health in NDCs and also some updates from current NDC submission process. Arthur, over to you, please.
Thanks so much, Enki. And hi, everyone. My name is Arthur Wiens. I'm a research fellow at the University of Melbourne in Australia, and I also support the WHO ACE team. It's actually really wonderful to see so many people online today. We have almost 100 people online. There's a lot of interest in this topic, clearly. And I agree with you, Enki, that it was actually really helpful to hear that very detailed overview from Amy on the WHO quality criteria for health in the NDC, because it really highlights the many opportunities that countries do have to include health priorities and health targets in their national climate plans. Next slide, please. I'd like to briefly take a step back to provide some wider context, but I'd go a little bit faster through my presentation just to leave enough time at the end to hear from the countries. And Amy has already covered most of the things on this slide, but just to reiterate a few important points here, that first, NDCs are an iterative process, so they are improved over time, and countries submit them every 5 years. And as Amy mentioned, currently countries are preparing to submit their third version of their NDCs. But that also means that countries are actually quite familiar with this process already. It's not the first time they have to do this. As Susan said at the start, this is not a new idea. And it also means that there's WHO guidance available. There's also UNFCCC guidance available. And countries are starting to learn from each other as well. There's already some best practices that have emerged now that this is the third time that countries do this. And so, of course, this year really provides an opportunity for countries to submit a stronger new NDC and to build on the previous NDCs and learn from those lessons. And that's especially important because we are currently still not on track. This is nothing new, but it's important to remind ourselves, of course, that actually currently, when we count all the NDC commitments together, collectively, they're still leading us to dangerous levels of warming. So that's an important reminder. Next slide, please. So a few reasons of why it's important to strengthen the health commitments of NDCs. And both Sandro and Susan actually have already eloquently spoken about this in their introductions. First of all, they're very important national policy tools that can help avoid the worst effects of climate change, but they can also help to maximize the health and economic gains from climate action. And so the WHO guidance we heard from Amy, I think it was quality criteria number 3, that specifically speaks about health co-benefits. And so it includes these helpful recommendations of how countries can actually maximize those health co-benefits to also make clear that taking climate action is actually a benefit to society and to your economies. Second point, it's also a really important process for ministries of health to actually be part of, since NDCs usually represent this whole of government plan on climate change. And so if ministries of health are not at the table in this NDC development process, the health sector might also not be prioritized in national climate plans, and that could be a missed opportunity for stronger cross-sectoral collaboration. The third point here points to the fact that the health community is actually taking very significant climate actions already. And it's important to also recognize all the work that the health sector is already doing and to add that to the NDC. Fourthly, NDCs are also really important reporting tools. And they actually play an important role in reporting on the work that's already happening. And so including the work in the health sector should be recognized there. And last point, very critical, of course, is the fact also that NDCs are also often developed in collaboration with the Ministry of Finance, and they can be understood as investment plans, as Sandro said so eloquently, that can really help secure national and international finance for climate and health actions. So there's quite a few reasons why NDCs are actually really important tools for us to look at, and why we should be ensuring that health is incorporated in them wherever we can. Next slide, please. So as already highlighted in the WHO guidance, there are many entry points for health in the NDCs, from reducing air pollution to taking action in the health sector itself, to responding to loss and damage to health and to health systems. But ultimately, when we take all these actions together, it's good to remind ourselves as well that healthy NDCs and healthy action plans are really national climate commitments that also protect and promote our health and the health of future generations in the face of climate change. So that's why NDCs are a helpful tool for us to engage with. Next slide, please. So in addition to the WHO guidance on NDCs that was just presented before me, WHO also conducts quite regular reviews of how health is actually included in the existing NDCs. And that's a very helpful exercise because it gives us a sense across all member states globally and across different regions which areas countries have actually prioritized, but also offers an opportunity for us to learn from each other and to align priorities where that's relevant. So for example, in the figure here on the left, the WHO review of NDCs found that the sectors for which most countries recognize health co-benefits from reducing emissions are usually food and agriculture and transport. So those are the sectors where most health co-benefit actions are taking place. While the figure on the right here shows that the various health adaptation components that countries have included already in their existing NDCs, surprisingly it shows that actually the health workforce, actions to support the health workforce, remain quite limited to date. So not many NDCs actually include health workforce specific actions. While other health adaptation actions such as health early warning systems or building climate resilient health infrastructure are much better covered. So these types of WHO reviews help us understand where WHO support would be most valuable. It helps us understand where the gaps might be. Health workforce is one of them. And so it helps us also understand where where countries have put their priorities, really, what they find most important at any particular time. Next slide, please. So countries are due to submit their updated NDCs this year. But unfortunately, so far, only 25 countries have submitted their NDCs. And I actually just checked this morning on the UNFCCC website, and there's 2 more countries that have submitted. So we're at 27 countries so far. So countries are slowly submitting their NDCs, and we're aware, especially across the WIPRO region, that many member states are still preparing their NDCs. But as you can see from the map, most have yet to make their final submission, especially in the WIPRO region as well. Next slide, please. In recent consultations by WHOAs with member states, we've identified several barriers, and several barriers were highlighted to integrate health. And that includes a lack of capacity and lack of awareness of opportunities. It includes the continued existence of silos across sectors and limited coordination sometimes, and especially also insufficient finance to actually develop those plans in the first place. On the other hand, member states also highlighted to us that there are several opportunities, including Ministry of Health representatives being able to join these national climate processes by participating in NDC processes, also providing more visibility and a stronger mandate for climate health activities, and also NDCs as a helpful vehicle for then both domestic and international resource mobilization. So many member states do recognize the opportunities that these NDCs could bring. Next slides, please. We've already heard some good examples of past NDCs in Amy's presentation, but now I'd like to share just a few very recent examples from the WIPRO region. Vietnam has a long history of leadership on climate and health, and the Ministry of Health is now actively involved in the NDC updating process. And this may also include a focus for the first time on reduction of air pollution in the NDC, and that would be building on the recent national conference they've had, to which WHOAs has been contributing. Next slide, please. Vanuatu is also in the process of updating its NDC. Very importantly, they've committed to deliver a 1.5 aligned NDC, which is really ultimately what's necessary to protect the health of communities from dangerous climate change. Vanuatu has also had a very transparent NDC process, really a great case study actually, and they've released a draft NDC for public consultation, which is still available on their website at the moment. And their new NDC will be informed by the existing policies and the existing targets they have. So they're not starting from scratch, they're building on existing work and identifying synergies with existing climate and health work. And the Ministry of Health is also involved in both the development of the NDC, but also the follow-up implementation and interpretation afterwards through a coordination body that they've set up called the National Health Cluster. So I think that's a really good example of the Ministry of Health not only being involved in drafting and developing the document, but then also maintaining engagement in actually implementing the actions that are captured in the NDC. And lastly, something really interesting about Vanuatu's NDC is that they also have one of the most ambitious commitments on securing the health and well-being of displaced communities, because climate change is increasingly forcing migration and displacement of communities in Vanuatu. So that's quite an urgent priority for them. Next slide, please. And then this is my last example of the Philippines, where the Department of Health has actually recently set up a dedicated climate and health unit. And that unit is now identifying existing climate and health priorities and assessing the progress they've made so far to hopefully then feed into the NDC 3.0 process. So that's, again, a good example of contributing to an NDC doesn't mean having to reinvent new plans and starting from scratch, but it's really an opportunity to assess progress and to build on existing work. And the Philippines example is also a really good example of building lasting capacity through a unit in this case within the government, and that will enable them to meaningfully contribute long-term to the NDC. Next slide, please. This is my last slide, just to highlight that WHO ACE is currently conducting a review of health in the NDCs in the Wipro region in particular. And we're aiming to develop a collection of NDC case studies and best practices across the region, because as you saw in my previous slides, there's lots of exciting work happening. And so we plan to present the preliminary findings of that review at the Wipro Regional Committee in October for your feedback and for any feedback. And then, of course, the ACE team is available to provide technical support to member states with their NDC development. We do really have a unique opportunity this year with the NDCs being updated as we speak, but also with longer term support in terms of technical support, but also implementation and financing of the climate and health priorities that might be captured in those NDCs. We also hope to facilitate continued cross-sectoral engagement on the NDCs, including at the regional attach meeting in Singapore this September. So please do count on the WHO ACE team to support you to incorporate health in the NDCs, and we stand ready to support you wherever we can. Thank you so much.
Thank you very much, Arthur, for very useful contribution to this webinar, reiterating why we need to embed health into NDC process and providing updates from current NDC update process. I would like to highlight that Arthur mentioned that from about 127 submissions, update submissions on NDCs, only 4 member states of Western Pacific region submitted so far the updates, and we highly encourage our counterparts, Ministry of Health, to proactively engage with the environment and other sectors to embed health in ongoing discussions. And we hope that by end of March or September, we will have more countries joining or submitting NDC updates. With the ending, I think we are already now, maybe I will have just 1 minute for recap of this presentation session. Amy and Arthur made very strong points that health and well-being is the ultimate goal of NDCs. I think this is the strong argument why we need to integrate health into NDC, into UNFCCC process. So it also shows the vital role of health sector to embed health in NDCs. So we highly encourage again to our countries to participate in the NDC update process, in particular to embed health in NDC plans. ACE might approach you in the coming months, not months, actually in a few weeks' time, as part of our review of health in NDC process. As Arthur mentioned, we are planning to have regional review of health in NDCs, a case study compilation. So your collaboration will be valuable, and we will follow up with you with counterparts individually. Thank you very much for the presentation, Arthur again and Amy, and hand over to Sally, please.
Thank you very much, Enki. So that leads us very nicely on to a couple of examples. And first up, I would like to invite Nathan Carbon from our country office in Micronesia. Federated States of Micronesia is one of the 4 Wipro member states that has submitted its NDC 3.0 and has included health. So he's going to just talk us through some of the successes and some of the enabling factors that have led to that. So Nathan, if I can pass to you, please. Thank you.
Thank you, Sally. Could you guys hear me okay? Okay. My name is Nathan Carbon. I'm a climate and health coordinator. I'm an SSA for WHO. And I'm from the Republic of Marshall Islands. So that's part of the country office in Micronesia. So just a full disclaimer. When I mentioned our National Climate Change and Health Policy Revised Action Plan, it could be shortened to also HNAP. Same objectives, just different acronyms. And I'd like to apologize for not having any slides. I thought we could do our presentation just by a Talanoa Bawanadok storytelling session. That's okay with everybody. So to start, the Republic of the Marshall Islands is one of the most climate vulnerable countries in the world. Just to give you an example of how isolated we are, we have one airline that services the Northern Pacific. It's called the Island Hopper. and goes to Guam on one day and Hawaii the other day. So as signatories to the Paris Agreement, RMI has committed to a series of climate adaptation and mitigation goals outlined in its NDC. And then within this broader strategy, the Ministry of Health and Human Services is spearheading the National Climate Change and Health Policy. So while we are spearheading, it is a collective effort to protect and build climate resilience. So health was prioritized in our NDC because it was a priority sector in our National Adaptation Plan. The National Climate Change and Health Action Plan actually predates our National Adaptation Plan. So while holding consultations for our NAP, the health interventions from on our NAP were taken out of our HNAP or our NCCHP, which was aligned with our joint National Action Plan, which was already aligned with corresponding RMI NDC adaptation targets. So the NCCHP maps out how how it directly contributes to fulfilling RMI's NDC adaptation targets. So there was a National Climate Change and Health Policy consultations were held pre-COVID. Many of our interventions on the National Climate Change and Health Policy were already slated to be implemented, i.e. rainwater harvesting and water safety monitoring. Since water monitoring is done by our Environmental Protection Agency, they have a project with UNDP that just provides rainwater harvesting and safety measures in our neighboring islands. So our climate change and health project, which is funded by GCF and it goes through WHO, was brought to us actually by the Ministry of Environment. They saw the need to connect climate change with integral parts of the government. It was introduced through the Steering Committee for Climate Change, which is called the TTEC Committee, or Tile Tilio, Lighting the Way, which is chaired by the Minister of Environment. So TTEC is central to the RMI, coordinated, inclusive approach to tackling climate change throughout many different stakeholders, including youth, the elderly, so on and so forth. So what are we doing now? So in response to consultation fatigue expressed by communities on neighboring islands, one example of how Ministry of Health and the Ministry of Environment are coordinating is we're conducting consultations together. So the Ministry of Health will do consultations with the health assistant, and then Ministry of Environment will do their NAP consultations. The NCCHP is not only a national health resilient roadmap, but also a key implementation tool for RMI's NDC. We're aligning specific health interventions with national adaptation targets, which enhance accountability, coordination, and effectiveness across sectors. And it also demonstrates that the Ministry of Health is not just the recipient of climate impacts, but a proactive force. So I would maybe give you a couple examples of our HNAP interventions and how it coordinates the RMI's NDC adaptation targets. One of our programs is a vector-borne disease control, which is mosquito elimination and surveillance. So the NDC adaptation target for this one is the public health, strengthening capacity to respond to climate-sensitive diseases. This is done through POA and CDC, where POA is Pacific Island Health Officers Association. They overlook all of the USAPIs. And it's a sterile insect technique. So the SIT project, just focus on controlling mosquito population. The first phase of the project was launched in Ibai, which is the second most populated island in the Marshall Islands. But well, if you have any any other questions or want me to elaborate more, I'm still here. But that would be all for my presentation. Muldada.
Thank you very much, Nathan. That is great and clearly shows how RMI is really mainstreaming health right from the beginning and creating an enabling environment that supports policy options. We're going to have a session for questions and answers at the end. First next I will go, to Dr. Biancan from the Deputy Director of the Department of Hygiene, Health Promotion, the Ministry of Health, Lao PDR, and our country office representative, Togos. Over to you, Togos and Dr. Biancan.
Can you hear me?
Yes.
Yes. Thank you. Morning, everyone. My name is Biancan Pisai, Deputy Director, Department of Hygiene and Health Promotion, Ministry of Health, Lao PDR. The UN agency support Lao PDR is liver mapping and NDC action plan for the period 2025-2030 covering agriculture, forestry, and land use change. Agency the sportation and pool development, waste management, water, and the Lao government give priority of health adaptation during the NDC 2 as well NDC 3. The WHO we have the climate change and health adaptation strategy for the 2018 to 2025 with 6 strategy direction. We assess health vulnerability in the climate change effect on health 2010, update the 2019 and 2023. Then this is the health national adaptation option to assess and match climate change risk to health adaptation for the next year. All strategy and direction, probability, and action or the clean, effective implementation. Key the HASNAP will be the key to the personal, the long-term health adaptation goal for the NDC for the next five years. May I ask for the Toko technical office in the mental health in the team the WHO allows to give the future the presentation on the WHO team going to lead the update of the health component the NDC. Thank you so much. Please Togos continues.
Thank you, Dr. Biancan. So can you move to next slide? So WHO is providing technical and funding support to MOH in assessing and also developing, designing a health component of NDC 3. So this is ongoing process. So that's why our presentation will be focused on the sharing experience on how we are developing health component of NDC 3. So UN consultation coordination meeting discussed priority mitigation and adaptation sectors, and health sector included as one of the most priority sector in health in adaptation chapter. And so WHO MOH is co-leading the consultation process and also designing the first draft. So all activity in highlighted in pink color already implemented, and so there are some activity planned which is highlighted in blue color. So MOH WHO consultation meeting, it attended with other sectors and also the development partners to be conducted on 25th of July to get inputs from the stakeholders, and then the review, comment, and final draft will be finalized and submitted to UNDP for final report, and also in this submission to UNFCCC. Next slide, please. So next, please. Yeah. I cannot control. Okay. So the first phase of the development of health component of NDC was assessment of achievement of the health component, which was implemented during the NDC 2. So based on this assessment, so in briefly, we can conclude that NDC, especially short-term objective achieved, and especially 2 projects with one from GCF fund, readiness project, and another one on World Bank project supported basic capacity building of the health and water adaptation capacity. So there are long-term objectives for health sector adaptation defined, but still require implementation, especially long-term capacity building is needed. That's why the NDC 3, including continuous health adaptation plan to be implemented during the NDC 3. So next slide, please. So the phase 2, design health adaptation objective strategic direction in close consultation with MOH. So 2 meetings conducted at MOH and also weekly coordination meeting conducted at the UN. And so WHO is providing technical and guidance support. So especially we are following the WHO quality criteria. Amy already presented. So according to the WHO quality criteria, so we decided to continue use HNAP and operationalize HNAP during the NDC 3. And because our framework of HNAP is very comprehensive and also providing the support to establish climate resilient, low carbon, sustainable health system, also maximize the health co-benefits from climate mitigation policy of other sectors and mitigation actions, and also advocate health benefits. So that's why HNAP will be helping to operationalize health component of the NDC 3 according to the WHO quality criteria. So please next slide. So phase 3 was defining and designing mitigation objective and actions for the health sector. So health sector consultation conducted and discussed and defined mitigation actions as a secondary priority. So while improving and implementing health adaptation action plans, the health sector will be assessing carbon emission at policy and health care facility level and designing menu options to reduce carbon emission from the health sector and increase awareness on importance of the carbon emission reduction and also develop action plan during the NDC 3. So next slide, please. Phase 4 design monitoring evaluation framework, which will be embedded in the HNAP and also NDC 3. So this is more focused indicator focused on the outcome, for example, number of health facility having safe water and sustainable waste management, and also climate resilient infrastructure and climate resilient healthcare facility, and number of workforce trained on HNAP implementation, and also number of facility having emergency response plan, and also healthcare workers trained on early warning system, and so number of intersectoral coordination meeting for climate and health included. So next slide, please. So this is summary. So I will hand over to Dr. Yuan Kam.
Yes, thank you. To go presentation, I show for the summary for government the Laos. NDC and health is a high level community commitment. This is collaboration with the stakeholder. Short-term objective of the health components of the NDC area on top. The NDC 3 need to build on the long-term adaptation capacity with assessing carbon emissions on the mitigation planning and advocacy. The fourth HNAP is operationalizing the health component and NDC 3. Lesson learned is excellence financing in the evidence-based data sharing. Thank you so much.
Thank you very much for that very interesting presentation from Lao PDR. And again, linking very strongly back into the Health National Adaptation Plan, or whatever it might be called, because in the case of RMI, it was called something different, but it really is showing how instrumental having a good HNAP is, both from a high level commitment point of view, but also to operationalize the health components. So with that, I would like to open out for some discussion and questions and answers. We have a few minutes left. I note there are several questions in the questions and answers session, and I will come to those. But first of all, there is a hand up from Asani Olumide. I hope I pronounced your name right. I wonder if we could open the mic to allow her intervention.
Hello. Hello, good morning.
Good morning.
Hello. Good morning. Okay, my name is Hassan Olumide. I'm speaking from Nigeria. All right, can I go on?
Please.
Hello. Hello, madam.
Yes, please
Hello?
go ahead with your question.
All right. Okay then. Considering the integration of, because I'm a waste management professional from Nigeria. I work in Nigeria as a waste management professional. So considering the cross-sectoral nature of NDC, the facts, considering the loss and damage fund. So what is the WHO doing on the on climate justice, considering the intergenerational implication of loss and damage? I'm particularly about climate justice. So what are the big emitters doing about the burden they've created for the world to deal with? So that is simply my question.
So thank you for the question, but I wanted today to focus on health within the nationally determined contributions and how we get the health sector to, so maybe we can take that discussion offline and we can open up to some other questions.
All right then.
And we'll take that question offline. Thank you.
Right.
If you can, any other hands up? So if not, maybe we look at some of the questions that have been put in the questions and answers, and please, everybody feel free to use the question and answer function of Zoom and also the chat in Zoom. But there was a question around the consultation fatigue that Nathan talked about, and the question of how do we make sure we both incorporate a wide range of NGO multi-sectoral views, but also that we don't reach this point of consultation fatigue on both sides. And I think this is a very, very interesting question, and one that there are a lot of different answers to. But I mean, certainly from my perspective, I think also giving back to the communities information helps alleviate some of that consultation fatigue. We're very good at going to communities, consulting them, but we don't ever go back with implementation options after the consultations. But I can see that both Arthur and Enki are writing, but maybe Arthur, you'd like to take the floor to answer it verbally. Over.
Yeah, thanks so much, Sally. And I think it's a really good question. And also Nathan pointing out that consultation fatigue is really a problem. And of course, these NDCs and other plans are only means to an end, right? We shouldn't be producing plans for the sake of producing plans. And I think thinking back of the quality criteria on the NDCs, there's quite a few points around building synergies and building on existing work. Because starting from scratch would indeed mean a very lengthy consultation process. But in many cases, for example, in the case of Micronesia, an existing adaptation plan is already either developed or is being developed. And so the role of the NDC might just be to highlight the key priorities that have already been identified in this other plan. And so it really also depends a little bit on where the country is at. In some cases, they won't have an adaptation plan or a health-specific adaptation plan yet. And then in that scenario, an NDC could provide a helpful process to at least identify the key priorities. And that might then lead to a more detailed consultation process, a more detailed HNAP further down the track. In a scenario where a country already has developed a detailed HNAP, and Laos is a good example, they already have a detailed HNAP. So the exercise is rather, what are some of the key HNAP priorities that we also want to see reflected in this national document, in this NDC? And can that help us with increasing the visibility of these priorities, increasing the likelihood of domestic and international funding, and being part of the wider national process? So there's ways, I guess, to both in terms of how you time NDC processes and in terms of how you build synergies with existing policies to reduce that burden. But there will, of course, be a burden nonetheless. And there's always that tension between how many people do you involve, how high is the quality of your document versus how pragmatic is it and how fast can you develop it. It can take a long time, as you alluded to, Christy, to develop one. And many countries have already been developing their NDC for over 10 months now. Maybe the one point of hope as well is that because it's the third time that countries do this, the consultation processes are already in place and they're consulting on increasingly specific measures. They're not just asking very open-ended questions, but they're asking, well, we've committed to XYZ priority. Are we delivering? What else do you need? What are your needs and gaps? So it is, I think, crucial to continue these consultations, but as you pointed out, to make them very specific, to focus on implementation and needs as well, and to build on synergies wherever we can to avoid duplication.
Great, thank you, Arthur, for that. There's another comment in the chat talking about the health workforce and the lack of focus on the health workforce in NDCs. One of the biggest assets that the health sector has is its huge presence, including in frontline communities. And then what is some of the explanations for the gap? And I think this leads to a broader question on also the lack of health even being mentioned in some of the NDCs. Several of the NDCs, if you do a search for the word health, it doesn't appear even one time, which I think is really interesting in itself. And as you say, that the health workforce is huge workforce at community level. And so how do we address the gap of trying to include them also into the conversation? And I don't have an answer. I think it's a very interesting conversation piece to try and understand where is it in a way that we're going wrong with some of this. Then somebody also still on this health workforce, capacity building aspects in terms of availability of dedication or dedicated staff for climate and health. And I think this is a challenge, and a challenge in many countries where there aren't dedicated staff for very many things. Everybody wears multiple hats. And so the climate and health is just one of those hats, and it becomes a challenge. However, the Republic of the Marshall Islands is one of those countries, and they have managed right from the beginning to really emphasize health. So that is why I had asked them to be part of this webinar, to learn a little bit from how they've managed, because they're facing several of the same challenges that are being faced by many other countries. So I think, excuse me, there are still some questions, and I think that gives us an opportunity to answer a lot of those on as we go through. It links into the capacity and resources to support first baseline assessment. Vimal has put, how do we have the capacity and resources to support greenhouse gas emission assessments of healthcare facilities? Is there external support that countries can tap into? And yes, so through the Alliance for Transformative Action on Climate and Health, a guidance is being developed on how to go about assessing greenhouse gas emissions of healthcare systems, of health systems. There is already tools for assessing greenhouse gas emissions of healthcare facilities. There are many people assisting external support for doing this work at country level in this region. The Healthcare Without Harm, for example, the Center for Sustainable Medicine out of the National University of Singapore. These are all partners of WHO, and they're all partners of within the Alliance for Transformative Action on Climate and Health on the task team looking at greenhouse gas emissions. So that there is a support network, and through the community of practice that Amy mentioned in her presentation, it's possible to access some of this. So I think with that, we will draw this discussion and Q&A to a close, and I will pass over to Sandro for some closing remarks. Sandro.
Thanks very much, Sally, and thank you to everyone who's joined us for this last period and of course our second in the series of webinars, as we look to really strengthen our support and focus on the critical nexus of climate, environment and health, accelerate impact and action, and ultimately deliver improved health outcomes across the Western Pacific region. I want to thank all of our partners for joining. We've had a very strong participation online. I can see from our country partners, from our member states, from our collaborators, and from many of our friends across the region and around the world. Thank you to our colleagues at headquarters, of course in our country offices, our member states, our colleagues from Laos, PDR, and all the way out to the Marshall Islands. It's been a very rich conversation, one very focused on implementation, very focused on action, and I think a very timely and important conversation in direct response to requests from partners and member states across the region. Thank you to our experts, Arthur and others, and thank you also to my team here in Seoul, and of course to DPM for joining us online. As you know, we see the impacts of increasingly severe weather across the region, and our thoughts and safe wishes to colleagues in the Western Pacific and of course across the Philippines as they face flooding, ongoing flooding today in many parts of the Philippines, but also in many other parts of the Western Pacific. Thank you for joining us for this webinar. We'll be in touch. We'll have another webinar next week on plastics, plastic pollution and health on the 31st in collaboration with regional partners. We invite you to join us again. There'll be information on our WHO channels and social media and emails about that in the coming days. But in the meantime, stay safe, and thank you for joining us. And we look forward to seeing you again next time.